We go now to our reporter, Laura Windsor, who has more on the 3D automated ultrasound.
There are more than 2.6 million breast cancer survivors in the U.S. due to improved treatments and early detection. We spoke with Dr. Marla Lander at Desert Regional Medical Center in Palm Springs and asked her to explain the advantages of the 3D automated ultrasound.
It is acquiring ultrasound images in a traditional way, meaning in the transverse plane, and then a whole volume of information is sent to a main computer, and then you can slice up that volume in any direction you want. So I know there is no portion of the breast that hasn't been scanned, which is one advantage. The 3D aspect, what it allows us to do that we've never been able to do before, if I shift to the coronal plane, I can actually see the skin of the breast under ultrasound, which is amazing. We've never been able to do that before. So if a lady, say, comes in with inflammatory breast cancer, I'm going to see those changes on her skin on ultrasound before I even go and shake her hand and say hello. I know what I'm dealing with. It's the perfect size to accurately assess normal tissue, and it, if you will, pops out at you when you're watching this or looking at it under ultrasound. So it's wonderful for detection or perception, and we have not had that ability before. And in a screening setting, and that's the most important thing for automated ultrasound, it has to be comfortable to the woman. We have to be able to do it or interpret it rather quickly, and it has to be reproducible, and automated ultrasound fits all those needs.
Dr. Lander explains how 3D automated ultrasound is performed on a patient.
Basically, when a woman is going to have this automated ultrasound scan, she's brought into a room and placed on an examination table on her back. While the lady's lying there and she's optimized in position, usually with an arm up over her head, the probe starts out at the level of the nipple, quickly assesses the breast tissue below the nipple. It takes just a few seconds. It will start at the lower portion of the patient's breast and automatically, taking less than 1 minute, scan upwards through the breast, almost to the clavicle. And then if we need additional views, medial view, lateral view, that's performed at the same time. So it takes approximately 3 to 5 minutes to scan a whole breast this way.
Does this ultrasound take the place of other breast imaging methods?
There is a subtype of breast cancer called lobular carcinoma that's responsible roughly for 15% of all breast cancers. That's the one notoriously missed by the mammogram, missed by MRI, missed by PET. And what we found doing this automated 3D ultrasound was that when we examined the breast or interrogated the breast in the coronal plane, these lobulars jumped out at you. And then afterwards we found its real value.
Dr. Lander explains the kinds of patients that would have this type of ultrasound performed.
This is an adjunctive tool to the mammogram, but it's not here to replace handheld ultrasound. Handheld ultrasound was specifically designed in the diagnostic setting, meaning if the patient has a palpable or clinical finding, or if there's an abnormality on her mammogram that needs to be worked up further, that's still done with handheld ultrasound. So this is used in the screening setting, and should we find an abnormality on the automated 3D ultrasound, we will go to handheld ultrasound as the next step, because that's still our gold standard, and characterize it that way. The indication for automated 3D ultrasound screening is a woman who has dense breast tissue. We don't need automated ultrasound or automated 3D ultrasound for women with fatty replaced breasts because the mammogram does such an excellent job. But in those women that have an overall dense pattern, I think it's an excellent tool in addition to the mammogram, or even if there's a solid area of dense tissue and most of her breast may not be dense, there's still an indication to do this.
You can help lower your risk of breast cancer by getting the necessary exams, making healthy lifestyle choices in what you eat and drink, controlling your weight, and exercising. For the American Health Journal, I'm Laura Windsor.